We begin tonight with trouble just hours away for one of our largest healthcare providers. Tens of thousands of Kaiser Permanente employees are about to hit the picket line here in California, as well as in Hawaii tomorrow morning. Good evening and thanks for joining us. I'm Marcella Lee.
And I'm Steffi Roche. Carlo has the night off. Along with registered nurses, this 5-day work stoppage also includes nurse practitioners, physician assistants, and rehab therapists. CBS 8's Richard Allen is here with more on Kaiser's response to this looming strike.
And Richard, you're also looking into the other local hospital system whose workers are planning their own action. A lot happening.
That's right, guys. Now, this will be the largest strike in the history of the United Nurses Association of California Union of Healthcare Professionals, with workers calling for safer staffing levels and fairer wages. For its part, though, Kaiser is calling this 5-day walk-off unnecessary.
You know, at the end of the day, I feel like Kaiser is handcuffing us.
Donnie Cobbler has worked as a physician's assistant at Kaiser for more than a decade. He says that he and his fellow union members, 31,000 in total throughout California and Hawaii, have no option but to walk off the job.
We don't want to strike, but Kaiser's forcing our hand. We feel like this is the last option.
Employees say that unsafe staffing levels and stagnant wages are threatening the quality of patient care at Kaiser, leading to this strike.
People doing 16-hour shifts, coming back on little to no sleep, having to stay over, having to do more with less.
Nate Polikoff has worked at Kaiser as an emergency department nurse for 8 years.
For the past 22 months, the staff have been escalating all sorts of patient safety concerns, predominantly based on appropriate staffing. We just can't get on the same page with that, and we owe it to our patients to make sure we have the resources available to provide the best care.
Along with increased staffing, workers here say they're also fighting for fairer wages.
Safe staffing goes right alongside with fair wages. If you can't retain the staff, if you can't pay the staff, if you're not paying enough of the staff, it equates to the patient safety and the appropriate care not being done the right way.
But Kaiser is calling this 5-day strike unnecessary, telling CBS 8 in a statement that on average, employees earn 16% more than peers elsewhere, adding that their latest offer would increase their wages by more than 21%. The union is reportedly seeking 25%, which Kaiser says will lead to higher rates for members and customers, with serious market implications. And while Kaiser workers are planning to walk off the job starting Tuesday morning, more than 5,700 nurses at Sharp Healthcare throughout San Diego are organizing an informational picket beginning Wednesday, seeking better wages and benefits, including an improved sick leave policy.
We are here to help make Sharp a better place.
Sharp points out that this is not a work stoppage and that the union has not called for a strike, adding that Sharp remains fully staffed and is continuing to provide the high-quality care our community members need and deserve. We remain committed to a fair and responsible contract for our nurses.
Kaiser's employees, though, will be on strike beginning tomorrow at 7 a.m. and not returning to the job until Sunday. Now, during that time, Kaiser says that its medical offices will remain open, although some non-urgent appointments and elective surgeries may need to be rescheduled.
So, Richard, we have the strike at Kaiser as well as the informational picket at Sharp. And we also understand that nurses at UC San Diego Health, they're also negotiating a new contract right now.
That's right. There's a lot going on right now. Now, their contract ends on October 31st. Now, last week, the UC System's president sent out an announcement saying that they have offered their nurses a statewide 27% pay increase over 5 years' time. Now, not sure yet whether the union will accept that deal, but their bargaining session is scheduled for this Wednesday. So we should find out this week whether or not they'll accept that.
Richard, thank you very much.
Thank you.